Now I ask Clare Black to join us, and your last but not least, and your reflections on the public health workforce.
Okay, thank you. My name's Clare Black. I'm a health improvement lead in NHS Ayrshire and Arran. I like to use pictures in my presentation, so I've got a few dotted in amongst it. I've been quite intentional though with the pictures that I'm using. These are from the campus that I'm based at in Ayrshire Hospital in Ayr, and I wanted to share with you our journey that we have been on in terms of workforce development. So although my portfolio in the main is around health improvement, I've also got a lead responsibility for the wider public health workforce development agenda locally. So I want to use some of the images of the grounds of our campus to take you on some of the journey that we've been on over quite a number of years. Just to go back to the reason we're here and the purpose of public health, and I wanted to use two key quotes that really reiterate some of the things that we've been talking about today and the importance of this sense that public health is about the organised efforts of society. And to me that means that everybody has a role to play within that, whether or not we're part of the core workforce or the much wider workforce. And it's about everybody having that collective action to improve health. And again, the quote from Health Scotland highlights that it should be a concern for everybody. And I just wanted to use those as a way of setting the scene for the importance of us recognising the workforce that contribute to improving health. There's been quite a lot said this morning about the context that we're working within, and I'm not going to say a lot because I think it's been mentioned already that we're working within quite a challenging climate just now, but there needs to be that focus on improving health and well-being, and it's about our workforce being competent and equipped to respond to that. We have had a focus on workforce development internally in NHS Ayrshire and Arran for a number of years, and the cube that Clare mentioned and spoke about was something that influenced quite a lot of the focus of the work that we have been taking forward, and that was really about us having a way of being assured that our own core workforce was competent and fit to practice. Quite different to the presentation that Nicola gave in terms of Glasgow, our structure is quite different in Ayrshire, and I thought it was important to include this slide because it gives some of the background as to why we took things forward the way we did and the way we have. We still have an integrated public health department where we're all one core cohesive team, and that's made up of a number of sub-teams. So that's health improvement, so that's the key team that I sit within, population health, health protection and resilience. And that department overall is made up of a number of individuals, and I've got some examples of the roles at the bottom of this slide. So that includes staff like myself, health improvement lead, we've got health improvement officers, we've got researchers, we've got consultants, we've got specialists, and we've got health protection nurses. And I like this tree in the grounds of the campus because it sits there quite proudly, but to me there's something about the environment within which we're operating, and what we've attempted to do locally is create an environment where our priority is on developing that workforce. And we had agreement that our focus needed to be on developing our core internal, what we classed as our specialised workforce. So those where our main area of practice was in relation to public health. And the way we approached that was by developing our own workforce development plan. So quite similar to what's been taken forward in Glasgow. We've got a workforce development plan that focuses on the individuals within this department and within those roles. I'm not going to go through the plan in detail in terms of the actions within it, but that plan essentially is about us putting in place mechanisms, supports to develop a workforce that's competent. And that group reports internally to our public health governance group. So in terms of accountability, it reports back to that group, because there's an assurance there that the staff governance agenda is being taken forward the way it should. And I think internally we see it as being an important staff governance element. I don't want to say too much today about registration, but one of the things that we have focused on over the last couple of years has been around practitioner registration. But that hasn't been the only focus of the work that was taken forward through the Workforce Development Group. So through that group, to give some other examples, we have developed public health learning forums as ways of bringing staff together to share learning, share practice. On a routine, regular basis, we identify staff that would go forward for further study, so whether or not that's about somebody being supported to commence a master's, whether or not it's to commence a doctorate. But one of the other things that we've invested quite a lot of energy in the past few years has been around practitioner registration. And I've included a quote that my Director of Public Health gave for inclusion today. And I think there's something about the importance that employers place on workforce and fitness to practice. And the start of Carol's quote is about it being imperative that our specialised public health workforce is fit to practice. And that's what we've been attempting to do locally. It's about us putting in place approaches to have a workforce that's fit to practice. And one of the things that Carol and other members of the senior team and other managers and also practitioners, I think, recognises about the important contribution that practitioners also make to that workforce. So like I say, we've been taking forward registration locally in Ayrshire for a number of years now, and we've got 13 individuals who are now registered as practitioners with the UK Public Health Register. And that's a picture just of some of those individuals in the middle. And I'm quite pleased to be registered because I see that as being part of something that gives an assurance around competence and fitness to practice. And I think we recognise that registration is part of that approach that gives us an assurance around the competence of our workforce. In terms of the perceived successes, I think locally it's something about there being coordination. I think we feel quite lucky in a sense that I have a portfolio around workforce development, so I have the time as part of my job to drive some of this forward, and I can help with that coordination of activity. But there is also something though about other people taking responsibility and ownership for that agenda, but there's certainly something about us being coordinated internally, and the Workforce Development Group allows us to do that because it then includes representatives from different teams representing the different areas of public health practice, and we can be much more coordinated then in the way we approach things. There's also something about the commitment that has been given to this, and that it is deemed as being important and essential. And I think the fact that we report to the staff governance, well, via our governance group, it's seen as being an important staff governance agenda. And just some of the examples that I mentioned around our participation in registration, for example, there was support given to staff for that, and the same way as support has been given for staff, for example, to attend whether or not it's postgraduate study. So there's something about us committing to developing our workforce and showing that. That's been an overview of the work for our core workforce. Going back to the previous presentations and the previous quotes that I used about the recognition of this much wider workforce, we have over many years been attempting to influence the development of the wider workforce, and we've attempted to do that in a number of ways. So we're linked in locally through a workforce planning programme board, which includes NHS and Health and Social Care partnerships, and that's quite a senior board, and that's our way of trying to encourage consideration of the importance of others taking forward a public health approach. And we're also working quite closely with our education colleagues via an Ayrshire Education Partnership. So that includes NHS, Health and Social Care Partnerships, University of West of Scotland, so that has a local campus, Ayrshire College and the Scottish colleges. And again, we're looking at the contribution that individuals who are emerging through whether or not it's health and social care courses or others, what their contribution can be to improving public health. We also have an ongoing training and development programme, and that offers some of the courses that Nicola mentioned in terms of improving health, developing effective practice, and that's something that we invest quite a lot of commitment and time and energy in, because we see that as being an important way of developing the wider workforce. And I've just included some quotes from reflections from individuals that have attended some of the courses, and there's something about that giving individuals the opportunity to reflect on their practice, allows them to consider what their job role has been and put that into some sort of perspective for them. So as well as us having a focus on developing what we see as our core public health workforce, there's also other activity locally to develop the much wider workforce. I certainly see the refreshed framework as an opportunity for us locally, and I'm really pleased that the event is taking place today, because I think it certainly gives us an opportunity to discuss how we can take this forward in a much more coordinated way. But I certainly see opportunities for using the framework locally. And I've got some ideas just from even Clare's presentation about how that can be taken forward through our workforce development group locally in terms of its application for our own core workforce. That's my contact details, and I wanted to finish with this slide. I'm not sure if you can see, but part of the walk, and these walks have been developed as a way of us providing access to patients, staff, visitors to the hospital, and the paths are absolutely fantastic. So when you're using them, you don't actually feel that you're at work. You feel as if you're out in the countryside. And there's one section of the path where you look to the left and it's a slight incline, but there is a wee kind of mini path that's been paved through it. And I don't know if you can see it in the picture, but I see the Refresh framework as being part of the journey that we've been on, and the next step in our journey locally to workforce development. Thank you.